let's examine very quickly some of the common features that we're going to see throughout many of these disorders. Seems like almost all of the disorders that we're going to talk about are going to have elements of the things that we talk about on this one slide. So, first of all, very high levels of anxiety. Anxiety is something that you're going to see very present in almost all of the disorders that we're going to talk about. Not all, but just about. And what we're talking about here is more anxiety than normal, where it tends to interfere with normal functioning. A lot of times this tends to be chronic, or it's ever present. In other words, the person is always stressed out, and there doesn't seem to be a specific cause. Now, don't get this confused, okay? A lot of times, you may be stressed because of something coming up with Christmas, or seniors get stressed because of graduation and things related to graduation. But the thing is, at least then you have an end of the tunnel in sight. You have something that you can kind of see and say, okay, once I get through Christmas, all this is going to be gone. And that's normal. Okay, that's a normal thing. But when we talk about high levels of anxiety for a lot of these people that have disorders, it's stuff that's just always there, and they don't really have anything to attach it to. We'll talk about a particular disorder with that in another segment. Studies have found actually that when we talk about stress, stress in childhood was actually positively correlated to depression and anxiety disorders in young adulthood. So again, it's kind of like, even as children, if we seem to have a lot of stress in childhood, it carries through in our adult years. A second technique, or a second thing that you will see with a lot of people who suffer from various disorders, is that they tend to avoid the issue. Whatever the stress is, or the anxiety, whatever's causing all that, they tend to escape it. They tend to, do something to avoid the issue. Freud actually called these defense mechanisms. He talked about people repressing or denying or rationalizing their issues, and that's what we talk about with avoidance. Okay, it allows us to tolerate the anxiety without confronting it. Now, a lot of this operates in Freud's terms on the unconscious level. In other words, we don't realize that we're even doing it, but it happens. Okay, so if we're having a big issue, if you have a big term paper to write or a big test to study for, you just kind of forget about it, or you put it off to the side and you avoid dealing with that stress. Now, does the stress go away? No. And in fact, we're going to find out that it makes it worse in the long term to avoid it. But that's what a lot of people do. And then the other thing that we'll look at here is self-defeating responses. And again, this kind of happens on the unconscious level, but it's where people, they may unintentionally continue to expose themselves to the cause of the anxiety. So, for example, somebody who can't stand their boss, and yet they go out of their way to be nice to the boss. I mean, obviously, they want to get a good report at work, so, they do various things to be nice to the boss, and they're so nice to the boss that now the boss invites them out to dinner. And now you're stuck because you don't like the person to begin with, and yet you have created this issue. You've put yourself in a bad situation. And again, many people do this all the time without even realizing it. A lot of times I think in these terms, I think of what I call yes people. You probably have somebody in your life who, if you know that you've got an issue and you've got problems, you can't get everything done, you know there's probably somebody in your life who you can go to who will always say yes. And the thing is, sometimes, I'm not saying all these people have issues, but sometimes people will say yes so often that they're doing so many things for other people that they never get a chance to take care of their own issues. And so the stress in their life continues to build. Charlie Brown, he's my favorite self-defeating response person. Because Charlie Brown, I mentioned on a prior screencast that Linus was 60 years old. Well, Charlie Brown's a little over 60 years old also. And he's been playing Little League. He's been managing their baseball team for years. And their baseball team is brutal. They have a piano player for a catcher. They have a dog for a shortstop. They have Lucy, who's out in right field and never catches a ball. Their team is not very good at all. And in 60 years, they've never won a game. Now, most people would probably quit and maybe take up something else to do instead of, playing baseball. But not Charlie Brown. He keeps doing it. Every spring, he has these great hopes of his team, doing well, winning games, and winning a championship. So he continues to put himself in that situation over and over and over again. And it never seems to work out for him. Now, the result of all of this, all three of these, is that people do manage to maintain contact with reality. They know what's going on. They know what's normal, and in many ways they may seem normal. However, a lot of these people are very anxious, and they don't tend to function well when they're under stress. And because of that, that can lead to various behavioral disorders of the milder type.